Coming up on the Doctor's Hospital podcast.
Things we tend to forget or don't think about is how our environment kind of plays a role in all of these conditions.
Try to do as much as we can to mitigate against serious risks to our health, whether it's in the workplace.
And so people have to interact. They need spaces where they can interact.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And today we are joined by three esteemed guests, three doctors actually, to talk about a very interesting topic, something that's a little bit different from some of the conversations we've had recently, but nonetheless health-related and very, I think, timely for what we're seeing happening in the world around us. So our conversation today revolves around the concept of how your environment impacts your health. So we're joined today by Dr. Nikolas Deal-Laroda, who's an internal medicine physician, Dr. Darnell Whymms, who is a graduate architect and sustainability consultant, and Dr. David Whymms, who is a counsel and attorney and civil litigation specialist. Welcome to the podcast, everyone.
Thank you very much.
Awesome. So like I said, we're here today to talk about the environmental impact on health. And we're going to touch on it from a number of different angles and directions. And I'm sure it's going to be a very interesting and engaging conversation. And perhaps it's going to shine a light on some areas of our health that we don't often think about. I mean, so much of our conversations tend to be like, oh, you have a heart issue, or you have, a lung issue, or you have a body pain, you need surgery. But this is going to talk about how the everyday environment, how we interact with it, how we experience it, what impact that then has on our health. So let's just start right at the root, at the very beginning. Can you explain how environmental factors influence our overall health and well-being?
Yeah, I think I'll start there, okay?
Go ahead, Dr. Laroda.
So good day once again, Dr. Laroda here. So as an internal medicine physician, like you just mentioned, we kind of deal with a lot of things like heart disease, lung problems, everything along that kind of line.
Mm-hmm.
But the things we tend to forget or don't think about is how our environment kind of plays a role in all of these conditions. And it does play a big role. So we can't forget how different things in our everyday environment could kind of cause us to have harmful issues and could actually make us feel better on a day-to-day basis. So some of the things we'll look at today, I'll just kind of outline. So things that we want to focus on are like our air quality, water quality, things like chemical exposure, how climate is affecting us nowadays, and the changes that go along with that. And something that's not commonly thought about or talked about is how noise and uproar and everything like that could also affect our health. In terms of specific environmental factors, like I mentioned, with regards to air and air pollution, with all of those things that we inhale on a day-to-day basis, it could kind of affect our lungs in that way. Persons get asthma, persons get COPD. There's chemical and toxic exposure too in our job places. And the same kind of results can happen. You get things like interstitial lung disease, cancers for that matter. So that's all actually an issue. Some other things, like I mentioned, in terms of climate, persons get exposed to UV rays and ozone. And so that could also cause toxic exposure and could cause cancers in the skin and so on and so forth. With regards to water and water purity. So for a long period of time, what we had to deal with is impure water and the diseases that kind of went along with that. So particularly communicable diseases. So, but since we've been introduced and been treating our water supplies and introducing purification systems, we've seen that those things kind of decreased over time. So that's something that we don't usually have to worry about so much more in this day and age, at least in the developed nations, I should say, because a lot of the underdeveloped nations still have that issue going on to this day. Sorry. And then, yeah, like I said, with regards to noise, we'll talk about it later on down the line with regards to urbanization and how that can affect our mental health on a day-to-day basis and so on and so forth. So I'll give us a chance to get into those. But those are some of the
Right.
specific ones.
It's interesting you mentioned the water pollution part and how in the developed world it's not as big of an issue. But like I find even just literally today before I came in here, we had our water heater needed to be replaced. And as the plumber was going through the process and he's emptying out the tank, I think has probably been about 10, 15 years. There's just a mountain of rust water that's sitting in the bottom of the tank.
Right.
And, his explanation was, well, that's not necessarily fully coming through your pipes, but at the same time, there's some level of rust that might have been flowing through because you see it in damaged clothing and things like that. So it's interesting because even though we do have all of this treatment of water and things like that, you still have these little things like a water heater that might be old that have an impact on the quality of the water that you engage with. Now, naturally, we don't normally drink water directly from our tap,
Right.
but at the same time, you still have to think about, well, if you use that to boil your pasta for food and things like that, that's still something to consider. So it is interesting. Some of the things that we might not necessarily think about, again, as we kind of think through and talk through this topic.
Right.
So that's an interesting one to consider as well. So you mentioned a little bit the idea of the urbanization of environments. How do health outcomes differ between urban and rural environments? And are there specific health risks unique to each?
So when it comes to the urban side of things, I mean, I didn't want to step on any toes.
No, go ahead.
Okay. But yeah, with the urban side of things, the benefit, I guess, is that there's more persons present. There's more access to healthcare in that sense, because you're going to have more hospitals being built, more clinics being present, more doctors being present, because all of those persons are clumped into those urban developed environments. Correct. When it comes to the rural side of things, you don't have that access to health. And so a lot of persons kind of tend to do things at home, stay away from the physician, try to wait it out. And that sometimes leads to the condition being worse until they're in an emergency state. Outside of that, the downside or drawback from the urban side of things would be things like spread of disease. So now so much more people in a population dense area. We just dealt with COVID. So we saw how easily it is to transmit diseases across from person to person just from being in the same place. And that's where the whole 6 feet thing came about. In the rural, obviously, it's more spaced out. People are in their homes, farmlands, spacing them out and so on and so forth. So it was a little more difficult for it to be transmitted in those populations. Another thing with the urban side of it, I mentioned the noise and the distractions and the stress of living in an urban environment. You go to work day to day, 9 to 5, that's kind of stressful in itself. You're expected to do all these things thereafter with regards to family and so forth. But beyond that, just being in a city environment, you have cars running all day. They're putting out, traffic, pollution. That's going to cause problems, the noise, and it's going to just kind of keep you in an aggravated, anxious state almost all the time. So we definitely see an uprise in mental health disorders in the urban populations as well compared to our rural populations. Just looking at it from a local standpoint, Nassau versus, our family islands. Same situation kind of stems from it. So you have more fresh, by the sea air in the family islands compared to what we get in Nassau, because so much more motor vehicles moving around. We have maybe 1 or 2 factories that could be putting out consistent pollution to the air. And we already talked about how certain lung conditions can develop from these places. So we have to keep that in mind when we're looking at our urban and rural environments and what benefits each has and what disadvantages each presents, and how we could kind of fix and address each of those in a appropriate manner. Yeah.
Okay. Anybody want to add to that in terms of the health outcomes between urban and rural, or any like unique health risks?
I mean, I think what is important to note is that regardless of where you are, whether it's urban or rural, there is an onus on persons, whether you are an employer or an employee, to take certain steps to mitigate against certain diseases.
Right.
So in the Bahamas, we have what is called the Health and Safety at Work Act. Okay, and so that's a set of laws that have been codified into our domestic legislation that helps to kind of queue up the employer to know that, okay, guess what? You have someone coming to work. You have to have a place that is safe for them to work. So you're talking about safe plant, safe equipment, And then there's also a continuing obligation on the employee themselves not to put themselves in unusual harm or risk or dangerous situations.
Right.
All right. So, regardless of where you are in relation to the health outcomes, there is this obligation that goes both ways, for us to try to make sure that we are healthy and that we stay healthy, and we try to do as much as we can to mitigate against serious risks to our health, whether it's in the workplace, whether it's someone coming into the workplace, because then you do have things that you call occupier's risk. So I'm not working there, but I'm coming there, and there I'm a visitor, and so I'm definitely expected to come into a place where I don't slip on the floor because water's there, or I don't walk into an environment where everyone's sneezing, coughing, no one's enforcing on them to wear a mask or whatever, like that kind of stuff.
The act you're referring to, that is our equivalent to the OSHA act in the US.
Essentially, yeah.
Okay,
pretty much.
Okay, cool. You mentioned the workplace safety part of it. I know of one or two individuals. I think this is an interesting consideration from an employer standpoint, because you have to recognize that each individual is different, right? So, for example, I know of a few people who have had challenges with their employer over mold issues, right? Because of the way their body is made up and the way they react, they have a sensitivity to it. And so, they were in a situation where they were having major health concerns that was able to be tied directly to the fact that there was mold present in their workplace. And so it is things like that people, ought to think and be aware of, because I imagine that's something where, if someone has recurring issues and there's no underlying factors and you can't really tie it back to anything, investigations like that, I imagine, would be something that you would want to do to say, well, okay, what does your home environment look like? Do you have mold at home? Do you have mold at your office? Do you have an oversensitivity to it, as compared to others, and therefore it may affect you more than it affects, someone else in the work environment, and kind of all of the considerations that come from that perspective.
Yes, definitely.
Yeah. Dr. Laroda, I know you mentioned climate change, and I'll open this up for anyone to respond, but how is climate change affecting public health today? And can you provide examples of climate-related health issues? I think you mentioned earlier overexposure to UV rays, but anything else in that space that we need to be concerned about, or we need to think about as we just navigate, this whole conversation around climate change and how it impacts us?
Well, I could add one or two more things to that. So along with the UV side of it, you could also think about just the temperature rise.
Right.
So naturally, us being exposed to higher temperatures is going to cause issues, especially for our elderly and young population. And you get more dehydration, you get heat strokes, so on and so forth. So we see a lot of that, especially during the summer months, because that's when the temperatures really, really peak for us. But just looking at the trends over the years that the Earth has been here, you see that it's a natural increase. It might not seem like a lot, but averagely you see that it's actually increasing. So that becomes an issue for us. And with those rising temperatures and changes that we see too, a lot of the vector-borne illnesses that we had before, they seem to also be increasing. So things like dengue and malaria. So that's also stemming from the changes in the climate as well. Because now everywhere is feeling more like a tropical type of area. So these factors, they tend to reproduce more frequently. But yeah, I'll drop those two in.
Yeah, and I think logic even would follow, right? So if you have, like you said, if many environments feel more tropical, then you may have more consistent rain. It's like if it's raining every day, you might not remember. You might think things like, hey, I need to go and turn the bucket over that's outside, or I need to check the water plants or the water pots the plant pots that sit outside that may collect or over collect water. All of these sorts of things, you tend to sometimes just become desensitized to it because it's always raining and there's always water collected somewhere. You don't even think about it in the same way, because it isn't as in the forefront of your mind. And I think that's why conversations like these are important, to remind people of all of these little things that you might just lose in the day-to-day busyness of work.
Absolutely.
So you can't really have this conversation without talking about socioeconomic factors and how that interacts with environmental conditions to impact health, especially in disadvantaged communities. So, what role does that play, and how does that intersect with the environmental factors?
We have something in the built environment that is called the triple bottom effect. The triple bottom effect considers social aspects, that's people, the economy, that's finances, and of course the environment. and we make decisions based on the three of them as a whole, not individually. And so people have to interact. They need spaces whether they can interact. And of course, there's the cultural aspect that is very Bahamian. We have to talk. We have to gap seed. We have to toss ideas, find somebody's opinion, about certain things. That's a part of our culture.
Right. And
so that would affect our health. And you can see how it stems into mental health, why we had so many issues during COVID. And of course, money answers quite a bit of things. Just go back to the climate change. When we speak about the increase in heat as a result of climate change, we look in the built environment at materiality. We built basically throughout the islands with using concrete blocks. And of course, the dividers in some instances are sheet rocks, dew rocks. These hold heat, moisture, etc. Right. And so you can see how that extends to heat waves affecting the body, etc. And of course, mold. And so we have to consider design approaches even in this. And that has to do with the finances. Are we able to afford a change in materials? Are we able to use methods or strategies that would involve mitigating against mold and what have you, and that's insulations and etc. Or even the application of different materials to prevent moisture sinking in, absorbing into the sheetrock, etc.
Right, and you're doing that also while balancing the thought process of, well, we live in a hurricane-impacted environment,
exactly,
and so you still need to maintain a certain level of safety while also considering all of these changes and how that impacted that. And that's why, to your point, it has become then a financial or an economic consideration, because you have to be able to afford it. You hear people talk about all the time, I know a few people who just went through the process of building their homes or doing renovations, and it's like, the cost of materials. And then you sit back, like I talked to my in-laws, and they're like, well, this is what we paid to build our house. And I'm just like, what world are we living in? How much has, and you look at it, and all of these things become serious considerations. And again, I think the point is, all of those then bleed back into the conversation of your health.
Yes.
Because if you're not having conversations with people who are kind of thinking in that way, or if you're not in a financial space where you can kind of have those sorts of considerations, then what type of impact does that end up having on your health? If you're living in a space that is more conducive to mold development and things like that, all of that tends to now become a part of the conversation. It's not as, like you said, I think people like to think about it as though it's isolated, but essentially all of those things come together to influence your decision-making process.
Right. And we have this thing, we have this thing in design where we design for people. And one of the things that I love to consider is that interaction and that space between the building and people. We do not design, or we should not design to make the building separate from the individual, the occupants or the owners of that space. That's very important. And I think that's where health comes into, and continuation of life and health, because there should be a space. We spoke about this thing about the dream song, where the building, the earth, and the people are all one. They're interconnected. And so when we consider the masses sometimes that we build, and how they exclude the environment, nature, that's another issue that impacts health. And so we should consider that as well.
Okay. Obviously, we talked about air pollution to some degree. Obviously, that's mostly an external sort of environmental factor. But what role does the indoor environment play in our health? And what are some common indoor pollutants that we should be aware of?
Well, that's interesting, because indoor environment, we find that the majority of our time is spent indoors. And that's a research that we did when I was doing a sustainability certification, that we have, so the indoor spaces must be healthy. And we consider materiality. There is an extended amount of what we call VOCs, volatile organic compounds, that are emitted from furnishings, from equipments, materials, etc., that can affect the health of the individual. And we breathe these. If you want to understand what I'm saying, step into a freshly painted room, you can smell it. And there are substances that are in these paints or coatings that are many times adverse to health of the individuals. And so in design, we research and we recommend and even sometimes invent, because there are designers who go into the materials design or fabrication of compounds, etc., that are more natural or sustainable. And there are architects who've actually designed edible building material. That's how far sustainability has become. And that's what we consider now, because the health of the individual is very important.
You gotta say that, because I have a 1 year, I have a 1 year old, and I don't want him to actually literally be able to eat me out of house and home. It's like, I'd like that to remain a figurative concept. No, but I mean, I think it is an interesting thing to consider. Again, a lot of things that people just won't necessarily normally think about in their day-to-day. I mean, I know, like, we obviously work in an environment, with our team, we do a lot of production, so there's a lot of equipment, there's a lot of things like that, but we also work in a space that affords an outdoor space where I don't think any of us take advantage of it to that degree, but where you can actually go out and take a walk outside in some fresh air in the middle of the day, should you want to, should you have the desire to. And I think it's something that you see as you look at some of the lists that say, the top employers, especially when you start to look at the US, where there's a lot more openness and understanding of these concepts, where that's the thing that comes up, is the access to outdoor spaces, or the time allotted for engaging in outdoor, or just having outdoor workspaces or meeting spaces. You don't have to be in your cubicle at the office in a meeting. You can take your meeting not just into a group meeting space, but actually into an outdoor meeting space to allow you to have access to that fresh air, to kind of have more options for things like that as a part of the consideration. And like I said, it's something that I think we here, obviously with the work that you're doing and the types of concepts that you're talking about, this is what we're trying to bring into the environment and into the conversation, so that people can understand, hey, these are things that we should consider, and they actually impact your health. And hopefully we don't have to see Dr. Laroda as much, and all of his friends, if we are understanding these concepts.
But we can work together, eh?
Yes, I mean, that's the idea, right? All right, so very, very interesting conversation thus far. We're going to take a quick break for some words from our sponsors, and then we'll be right back on the Doctors Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctors Hospital podcast. Again, today we are talking about environmental impact on health. We are joined by Dr. David Whymms, Dr. Darnell Whymms, and Dr. Nikolas Deal-Laroda, and we will continue our conversation on how the environment impacts our everyday health. So we've talked a lot about, the environment part of it. Obviously, we have Dr. Whymms on, who is in the legal space. So I do want to kind of touch on the policy and the legal approach to some of these things, and how, those policies are crucial in mitigating the adverse health effects on environmental hazards. So what policies do we have? I know you mentioned the safety at work one, but what other policies do we have that exist here? And why are they crucial in this process of mitigating the impact of the environmental hazards? And then jumping off of that, how can individuals also advocate for a healthier environment?
Okay. So, we did speak about the Health and Safety at Work Act. Okay. And this is a set of laws, as I indicated, which have been codified to help to mitigate against adverse effects, in the workplace. And that is something where the employers and the employee should basically take heed of. But outside of that, there's always an obligation on the employer outside of the actual law that governs or that that is codified. You can find in the law books. Okay, there's also policies that the employer should put in place in the workplace, and so you may have an employee handbook. Okay, you may have an employee manual, something that the employer puts together to ensure that everyone basically who's working in an environment knows, okay, these are certain practices and certain guidelines that the employer expects for the staff to adhere to. They should be published. They should be, first of all, the employer should be aware, or the employee should be aware that these exist. So take, for instance, when you're coming into a workspace, you're applying for a job. It shouldn't just be a situation where you have a contract, you have an end date, a begin date. You know what your emoluments and your benefits are going to be. You sign the contract and you walk away, knowing that at the end of a certain period you're going to get remuneration for your work. There ought also to be a situation where the employer provides to that employee some guideline, whether it's a policy or a practice, in a document, which can be referenced by that employee, or at any time, to go and look at to see, okay, you know what, if there is something that happens in my workspace, what is the protocol? What is the policy? What do we do to prevent certain things from happening in the workplace? So I kind of just want to jump in a little bit. I've known of a situation where, and I think we spoke about it earlier about mold. There was a particular individual who had I guess we'll call it hypersensitivity to mold exposure. And he was, in an environment that became decreasingly uninhabitable. Let's put it like that, where the staff ought not to have been forced to work. And I shouldn't maybe use the word force, but they should have been provided a better workspace to work in. And became ill. He complained to his employer. They took him out of the environment. But the thing about it is, and I think you mentioned this earlier, there was no investigation really done to see what his home environment looked like. Whether his air conditionings at home were clean, whether there was issues at home, because that particular employee, every time he came back to work, he said, "Oh, I'm feeling ill again. I'm and so it ended up into a court battle, where that particular company through his employee, he sued his company. There's no outcome of that particular cases yet, and so I'm actually talking about a matter that's live before court, exactly. Right? And so there are things that the employer ought to make sure and to ensure that the employee is aware of, and as I said, it shouldn't just be a particular law, but it should be manuals and policies, and yes, definitely.
It's interesting because obviously we work in an environment, and when I say we, I mean broadly in the hospital and health system environment, where there are a lot of different equipment and materials, chemicals, all sorts of things in between, obviously pharmaceuticals as well. So there are a number of policies that govern in that space. What I find interesting, because I've seen it here and I've seen in other places that I've worked, and you can see it starting to filter into the work environments where the expectation from employee to employer of providing a safe work environment is there. But I've also seen it in the actual in the review documents. So like when you get your annual performance review, one of the things that people have on there now is, you as the employee maintaining and cultivating that safe working environment. And I've seen that start to actually show up in a number of places that I've worked in my career. I've seen that start to pop up into and I always found it interesting because I'm like, you're reviewing my performance as an employee, but you're factoring this in. And I think it speaks to the idea of this is as much, there's a responsibility that you, the employee, carry as much as the employer. And I think you mentioned that when you were talking about it the first time, but it is something to consider, that you're starting to see it filter into things like performance reviews and things like that for the employee to maintain their end of the agreement as well. Because you have someone, especially if you think about in a space like healthcare where there's so many different things that you can come into contact with, your ability to maintain a safe working environment from your own activities is going to be very critical, and could be very damaging if you don't.
I just wanted to touch on the last part of the question. That says, talking about how
Advocacy.
the advocacy part about it. I think is very important for employees, particularly because we're the ones who normally are affected in the workspace. I mean, it's not to say that the boss is not there or is absent, but the employee are the ones that basically spend the most time in the workspace. I think what is helpful, more so, is that the employee advocate in reference to the environment, not just complaining about okay, this is a issue we have here. Document what it is that's going on in the workplace. And I think it's a bit touchy sometimes when you put pen to paper, because people have this thing about you're reporting and whatever, but sometimes the paper trail is what actually saves you. And so if there is an issue, instead of just complaining in the kitchen, in the lunchroom about how what's going on is affecting you, just say to your employer, this is what's affecting me. You send them an email or whatever, and that kind of thing can be helpful.
As with many things, and I'm sure as someone in the legal field, as a legal expert, documentation is key.
Critical.
It's critical. Yeah. So moving on to, again, I guess continuing kind of off of that conversation around self-protection, what steps can people take to protect themselves from environmental health risks, whether it's at home, in the work environment? And then I guess the second part of it is more so for you, Dr. Laroda. Are there lifestyle changes that people can make that make a significant difference?
Sure. Okay. I'll try to tackle both of them.
Sure.
So I mean, in terms of some protective steps, we've talked about basically for the whole podcast, the things that kind of affect us on a day-to-day basis. So just looking at some of those things, like what I tend to recommend, to my patients, especially those like asthmatics and COPD patients, is trying to figure out a way to clean the air in their home environment, essentially. And one easy way to do that is to purchase something like an air purifier. So you put that in your home. Yeah, absolutely. You put that in your home, and if you have sinus issues, asthma problems, it cleans any particles.
Highly recommend.
Yeah, we mentioned mold too. So all of those tiny particles that are floating around in the airspace at home, it would be basically picked up and kind of decrease the amount of exacerbations that you see on a day-to-day basis. Other things that can be done. So we talked about water quality and so forth like that. So using water purification systems in the home for your tap water as well as for your day-to-day drinking water, you could actually add an additional purifier to the tap system and get an even more pure supply. So stuff like that would kind of avoid the gastrointestinal infections that we see from time to time. So we tend to recommend that to our patients as well. When it comes to like the foods that we take in and so forth, that can also be a method that we take on to kind of prevent issues that we see. So for a lot of patients, we see that we eat a lot of dairy products, but truthfully, our bodies weren't made to digest dairy products. So a lot of persons you hear, they say they're lactose intolerant, but technically everybody's a bit lactose intolerant. It's just grades to it. So those persons that you see get these upset stomach and other gastrointestinal symptoms is because they just have a more severe reaction to those things. So food choices becomes a big issue. And then just a little step beyond that, then on a larger scale, we talk about like food regulations and so forth. So every now and again, you hear on the news that there's some outbreak of some illness or bug in a food supply, for instance. So because those food regulations are in place, that kind of helps, our day-to-day health, because now those things are picked up, taken off the shelves, and we don't get affected so much. Are there any particular lifestyle changes? Like I said, kind of leaning into the same kind of way. So just the level of activity is one big thing, right? So we talked about having green spaces in the office. A lot of places nowadays tend to also implement a gym or a fitness center in their workplace as well. So that helps our working individuals to increase their activity level, get more sunlight exposure in terms of mitigating depressive symptoms. fresh air and so forth, without having to be stuck in a cubicle from an 8-hour period. You have a chance to actually go somewhere else outside of that environment. Beyond activity, we talked about food intake, but things like personal choices we make in regards to taking in toxins like cigarette smoke and so forth could also be a big issue, and alcohol intake. So all of these things should be kind of minimized if you're gonna do it, and if you can avoid doing it, period, that'll be even better, because then that decreases your risk for a lot of the non-communicable diseases that we get on a day-to-day basis.
So where does technology fit into all of this? Because obviously, you know, we talk so much about the advancements in technology, from, you know, just speed of access, wearables, all of these introduction of different devices, you know, smart this, smart that, in terms of, you know, your TV, you have smart ovens now, you have smart refrigerators, freezers, etc. You know, just thinking broadly about that, are there any technological advancements that are helping to mitigate the negative health impacts of environmental factors?
Yes. In design, when you have a concept, you can actually test that concept to evaluate human comfort. That's thermal comfort, the amount of light entering a building. You know, you can evaluate how much light, what type of light, and of course determine the orientation of the building, the materiality, because you can test materials to see how best these materials would work under certain conditions, and what design would be best fitted for a certain design intent. And you, of course, with AI now and all of the other interventions, you can simulate thousands of variations of that one concept. So design within itself takes you a long way to determine materiality, how much, how thick. I met a guy who was an engineer, and he actually told me that they did the same thing even with aviation. They flew planes in concept before the plane was actually built or designed in reality. And that's the same thing with buildings. We test buildings. We do lighting simulations, material testing to evaluate materiality and the, like, you know, acoustics, because again, noise entering a building, that was one of the studies I did when I did my master's, evaluating some buffing to a building to limit or prevent sound from nearby streets, traffic, etc., filtering into the building, and that would determine health as well. So yes, we do have technology, and we do have those new advances that would evaluate how healthy a building could be and how people would respond in that space.
So I imagine you have devices you could use to test the air quality in your home, to detect the presence of mold. Same thing probably I imagine with some of these, you were talking about the water filter systems to let you know exactly how much pure impurities exist in the water to begin with. And I think that's the thing. I think one of the things we've been back on the train of doing the podcast for I think about 6 months now, just about. One of the things that I think is just consistent is just, knowledge is power, right? So I think the idea of even just having this conversation and allowing people to understand, what's out there and what they should be thinking about and considering. And I imagine with technology, even some of the things we're talking about would get, less and less expensive, more easy to access over time as technology advances. But it's things that we should, we should think about and we should care about. So like I know, it seems like for our 6-year-old, there's some level of a sinus issue. And so that's why when you were talking about the humidifier purifier, like we got one of those because we realized like, it was just something that was necessary to assist with her, because you'd have sinus issues pop up every so often. It's like, okay, how do we manage this? And eventually we did some research and realized this might be helpful. And we found that it's incredibly helpful and it's allowed us to manage it a lot better. Now, obviously, Like, she's not in the space, just for anybody who might be listening, don't jack up my insurance. She's not in a space where she has asthma or anything like that at this point, but it's obvious you want to make sure what you can do to mitigate and even prevent, because at that age, I don't think she'd be diagnosed anyway. But the idea of keeping ahead of it, so if it's something that you could avoid turning into full-on diagnosis, then you do your part, right? So that's why, like I said, I was so intent on that, because we've seen it be very meaningfully impactful in our home with our kids. Right. So as we wrap up, I always like to kind of, end looking into what is the future, the next phase of a particular conversation area. What does that look like? So what do you see as the major trends in the relationship between environment and our health over the next decade? And then what changes do you foresee in terms of how we better manage that whole process? And I think everyone, if you want to, has a chance to take a stab at that.
Okay. I'll start. I perceive that building as normal, the conventional building is going to take a back burner. We're looking at the economic benefits. So people are looking at saving money on energy, because energy is a major consumption in a building, period. And so we're looking at how we can use air conditioning regularly in some instances, or not at all, or whether we can use lighting or not at all. And so I'm saying that we're gonna look into more natural approaches or interaction with natural spaces, and bring that into the built environment, using sustainable strategies that would benefit not only the immediate but the long-term run of that building. So there'll be benefits for having a green building.
Right, you're looking at short-term
and long-term benefits. Health, yes, of course. There's that nostalgic or that connection with, I remember when there were trees here, but now there are trees inside, or there are trees. And so we're reconnecting nature with present living, but more so, we're saving and accumulating funds as a result of doing it naturally.
Yeah. See, I don't know. I can't let the rest of my team listen to this, because all they ask me for is, them fake plants you wanted to buy, we have to get real plants. Dr. Whymms, anything you want to add?
Yeah, I think it's my hope really that the government takes a very, very proactive approach in reducing the cost of rates and tariffs that allow not just homeowners, but the stakeholders and the developers of this country to be able to afford materials that would lend to building a more sustainable, clean, and healthy environment. The fact of the matter is, we live in a country where we have summer 365 days of the year,
basically.
And so to bring down the cost of what powers the earth, to our into our homes, I think it'd be a tremendous benefit. And so I'm hoping that if this podcast is being heard by any of the movers and shakers, that they would take the initiative to advocate not just on behalf of their constituents, but the country as a whole, to make the cost of sustainable and healthy building materials something that everyone should be able to and can be able to afford, and just help to move this country forward, because we deserve it.
Agreed, Dr. Laroda.
Yeah, so along the same lines, definitely hoping to see better health equity come down the line, where persons who are more marginalized and disadvantaged can have more access to healthcare and the things that kind of lead to better health. With regards to the energy vein, I think that I already see a trend toward more renewable sources of energy. So I think as time goes on, we will kind of move more in that direction and move all the way away from fossil fuel usage, which would definitely decrease our pollution in the air and so forth.
Yeah.
We mentioned AI. I think that's going to be a big deal coming forward as we continue in healthcare and continue in environment and building design and so forth. So like you say, we could always test things out prior to implementing them in actuality and real time. So I think it's going to be a big trend change over the next couple of years, and we'll definitely see it on the forefront.
Yeah, and hopefully conversations like this will help to grease the wheels in that direction, right? I think it's always critical to start the conversation somewhere. Obviously, there's a lot of work that's being done by both, well, actually by all three of you in this space in terms of just from an education standpoint. Obviously in the design and architecture space, in the legal and advocacy space, and obviously as a physician, just kind of preaching the importance of considering this in the first place, and how all of these things play together with your health. So, I want to thank you all for joining us today. It's been a very, very good conversation. Thank you for taking time out of your busy schedules. I know we've been working to make this happen for, I think, a few weeks now. And I'm very glad that we were able to get you all on.
Thank you.
Thank you.
for having
Thank you
us.
very much.
All right. So to our listeners, as always, we invite you to like, comment, subscribe, and share. And we will see you here next week on the Doctors Hospital Podcast.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.